Alrighty. Hello, everybody. Welcome to another session of dental shadowing. Today we have Dr. Jumoke to talk to us today. She is in implant dentistry and she's also a business and lifestyle coach. So thank you so much, Dr. Jumoke, for joining us today, and you can take it away.
Thank you for having me. It's really exciting to be able to talk to younger people. I really wish I had this opportunity growing up. I think a lot of huddles would have been probably easier for me as I kind of navigated my way through dentistry. So let's get started. I will, tell you a little bit about myself professionally. So I attended Clark Atlanta University, graduated with a degree in biology in 1997, since like forever ago, and then went on to Howard University College of Dentistry. That's where I got my dental degree in 2001. Since then, I've taken a lot of post-grad courses. As she mentioned, my practice is really focused on implant dentistry. And I really do believe that implant dentistry is the future of dentistry. So I have taken what is called the Maxi course at the Medical College of Georgia. I have a mastership in both the ICOI and the AIP, which you'll find out are dental organizations that help to certify dentists when it comes to implant dentistry. I am an associate fellow candidate with the AID, which is another organization. So you can tell I'm a CE junkie. Like I love to learn and I just keep going, which is something you'll learn as you go into dentistry, because technology and innovation is constantly changing, that it's important that you stay ahead of it in whatever field you're in. I have a private practice in Cartersville, Georgia. I am part of the mentor and the faculty members at Implant Pathway. This is a continuum for general dentists who want to place implants. So I basically help them train other dentists how to place implants in their practice. I am a business and lifestyle coach. I really do help female medics, so female doctors, female dentists, nurses, and I'm launching a program really soon, so be on the lookout for that. And I am married and I have 3 amazing boys. Next. So a little bit about me. I was born and raised in Lagos, Nigeria. Hence the name Dr. Jumoke Adedoyin. It's a little tongue twister there. I moved to the US in 1995 to go through college. I'm married to my husband, who is also my best friend. My gossip partner, is what I call him. We've been married for about 22 years. I'm a mother to 3 boys, 19, 15, and 12. My oldest son is actually a pre-med major at University of Georgia. Doesn't want to do dentistry. I don't know why. And as a family, we're avid soccer fans. Go Arsenal. Like, we're all about soccer in this house. And what do I like to do when I'm not working, which is hardly ever? I love being home. I'm definitely a home buddy. If I'm not home, then we're traveling. I love to travel with my family. I love to read. And I just kind of really love anything that is intellectually motivating. And that's a picture of my family. So one of the questions I get asked is like, why dentistry? But then I say, why not? Like, women are in every facet right now. Like, we're transcending every profession. So I could have been anything. So why dentistry? I think I kind of got into dentistry as rebellion, honestly. So my 2 older brothers are medical doctors, and we all grew up. We were like, if there's anything like 3 peas in a pod, that was us. We did everything together. And as I got into my teenage years and they went on to med school, everybody just assumed that I was going to go to med school. So I think I kind of got a little defiant and I thought dentistry. So, and then I got to, I started looking at it. And like I said, if I had a program like this, then I would have been like, yep, sure, because I am very artistic. I love to help people. Like, I have a passion to help people. And so if you're going into dentistry, and you'll find out in a minute, if you're going to, and you'll find out also why I kind of went the path I did. But dentistry, you have to love people. Most people don't like to go to the dentist. Most people have a problem with people being in their personal space. And most people are very self-conscious. So there has to be a natural empathy there, if you're going to be a really good dentist, that because patients are going to need to want to, you need your patients to want to come to see you. And they have to know that they're safe and they're secure. And so that's kind of why I chose dentistry. Next. So I'm going to give you a little bit about my journey because dentistry is so different from medicine. With medicine, you go to med school, and then everybody goes through a post-grad program, regardless of what you're doing. In dentistry, you don't have to. So I actually finished my 4 years out of Howard, and I decided I wasn't going to do a post-grad program just because I just didn't feel like I needed to. And also just because at that point I was expecting my first son and I was done with school. So I moved back to Georgia and I took a job with Affordable Dentures right out of school. Now I've got to tell you, when I was in school, I loved the denture clinic. I was naturally gravitating towards it. I like to take care of older people. I was my grandmother's favorite. And I just like being around older people. Like they have so much wisdom. And I have the patience for them. A lot of people don't. But I hated extractions. Like I didn't like it at all. So I got out of school and I found this job, and all they did was dentures and extractions. And I was like, oh my goodness, I can learn the dentures. I hate extractions. However, I was matched with a really good mentor doctor who had enough patience for me to teach me and to walk me through learning how to do extractions, which is taking out teeth. And I ended up finding out that, oh my goodness, I love it. However, like most people, when you have a dream, when you're going through school, I thought, you know what, I'm going to finish dental school and I'm going to open this dental spa, and we're going to have a water fountain, and we're going to have marble. And I had all of that in my mind, even at that age. And so I left Affordable and I opened a cosmetic private practice, and I didn't like it. Like, it was great. It had all the water fountain. My husband's a builder, so he built me this magnificent practice. And I did it well, but I just didn't have that satisfaction. And that's kind of something you'll learn as you get older, that loving what you do is so much more important than what it is that you do. Like, you have to really love it, because that's what's going to give you that longevity for you to continue in that career for so long. So I didn't love it, but I realized that every dentist in that area sent me their denture patients because they didn't like dentures. I like dentures. And every dentist sent me the extractions because they didn't like extractions. And then I liked extractions. So a lot of people ask me this question in my coaching. It's like, how do I know my calling? Like, how do I know what I'm meant to do? Because I don't want to make a mistake. And I always say, what do you like to do? Like, we all have in us this innate, like just this creative innate desire to do the things that we've been created to do. So, but I didn't know that then, right? So I went to private practice, and then I realized I was doing that. So I had an opportunity to go back to Affordable Dentures in 2009. And at that point, I think I had more sense. And I was like, okay, I'm going to do this. This is what I love to do. And so I did. Now, if you know anything about dentures, people that wear dentures, their dentures move around all the time. And if you know anything about implants, we put implants in the mouth to replace missing teeth. So once I joined Affordable Dentures, it was almost a natural progression to go into implants. And that's kind of how I found my way to being an implantologist. Next slide. So let me tell you a little bit about my practice, okay? So like I said, I have a private practice. I am affiliated with a management company. In dentistry, that's called a DSO, a dental service organization. So it's a big company. It's like an umbrella company, and they help you manage your businesses so that you can focus on taking care of your patients, right? So you do have the same name, you do have the same brand name, and you kind of work under their brand. So my practice is in the Northwest corridor of Atlanta. It's in Cartersville, Georgia. I've been there for about 12 years now. And it is limited to dentures and implants, which is what I love. And what's the advantage of that? So I like to call it almost a subspecialty, because we only see patients that need that. And because I only see patients that need dentures and implants, those are the patients that come in, and those are the only services we do. So my practice is extremely efficient because we do the same things over and over again. And the learning curve is a lot shorter because you're not doing root canals and veneers and crowns. You're just doing the same thing. And because I'm under a management group, and I think right now there's about 330 practices, we have buying power. And so we're able to save a lot of money and pass those cost gains over to the patients. So our fees are way lower. And so we're able to serve more patients because we don't charge as much, but we're also able to impact more lives, and which is what I like. And because also I have a management company, I'm able to maintain a better life balance. You'll find out as you talk to more doctors that the burnout in medical is real, like super real. Next slide. So I want to kind of talk to you guys about what I do in my practice, right? So like I said, I only see a set group of patients. Most of my patients, so I'm going to give you the demographics. Most of my patients are in the lower socioeconomic status, so it's not a lot of money. Most of them have never been to the dentist. Most of them come from family members that maybe had dentures, and they just have this preconceived in their minds that because my grandmother had dentures, I'm going to have dentures. So they don't have a really high dental IQ, right? So most of them also can't afford to get veneers and root canals. So I serve that population, and that's why I love my job so much, because I'm able to really impact people's lives. Like the people that come to see me, they really need to see a dentist. And that's also why it's so important that I'm passionate and I have a lot of empathy, because a lot of them have such bad anxiety seeing the dentist because they haven't seen a dentist in so long. And also they're afraid of being judged. So a lot of people that have problems with their teeth, they think everybody's laughing at them. So you go into my practice, and this is what I teach my staff, to show a lot of empathy, because they may never go back if you make them feel bad. So I'm going to go through 3 cases with you today. Those are kind of typically what I see in my practice on a daily basis. So conventional dentures, pretty much that's what a grandmother wore and put in a cup at the end of the day. We do a lot of this. I probably produce maybe 10 a day. The great thing about my practice also is I have a lab on site. So I don't have to send my cases out, which is another reason why patients really love to come to me, because if there's a problem, we fix it in-house. I don't have to send their case out. We can get them a denture in the same day. And so it's always nice to see them walk in one way and walk out another way, which is always amazing. So the first case I'm going to share with you guys is a case of a young lady. She's actually 38 years old. She had a history of drug use in the past. She's a recovering meth addict. And she came in because now she's clean and her family had put money together so she can start her life over. Next slide. So this is what walked into my practice that morning. This is all she had. Like she literally had 6 teeth on the top and maybe like 8 teeth on the bottom. You can see all the decay there. She was also in an abusive relationship. So she just had so much. She had a lot of anxiety. She had self-esteem and self-confidence issues. And I see this every day. These are the patients I see. So you can imagine when they walk in, if you walk in like this, she had her hand over her face. She didn't want anybody to see her. So what we really do is take impressions in the morning, and that's like putty, and give it to our lab to make a denture. They make the denture the same day. The patient comes back in the afternoon. I remove the teeth, and next slide. She walks away this way. This was all in one day. This is why I do what I do. Of course, you can imagine she cried and I cried. I'm really a crybaby, very emotional, but this is life-changing. This lady came back. So this happened probably about a year ago. She has been back to the practice. I didn't recognize her. She has a new relationship. She has a job. It's so amazing what the teeth does. A lot of people don't think about it because you have a pretty smile, but you don't know what it is like when you don't have a smile. So this is what we do every day, 5 days a week. We're changing lives every day. Now, implants. Where does implants fit in? Lower dentures. I'm going to give you guys a little education here. The dentures don't stay, they stay in by suction, right? They have to put like denture glue. I'm sure you guys have seen the commercials where you put the denture glue and stay in. The lower, because the mouth moves and the lower jaw moves, that denture moves around a lot. So when people wear dentures, they can't really eat like meat and potatoes because they can't really bite into it because dentures are made out of acrylic, another word for plastic. So what we do, what implants do is you put implants into the jawbone and then you snap the denture on it so that the denture does not move. So we're going to move on to the second case that I'm going to present to you today. So this is what an overdenture is. You've got two implants on the bottom and you snap the denture on it. And that way, when the patient talks, the denture does not move around. This has become the bread and butter in my practice because we know lower dentures move around, and most patients, because it moves around, don't want to go to restaurants to eat because they have to take their dentures out. I'm sure you've seen parents or grandparents that take their lower denture out to eat. This prevents them from doing that. It also helps with self-esteem because they're not scared, that the denture is going to fall out while they're talking. Next slide. So again, this is what we see. I call this terminal dentition. This is just patients that, so one of the things that you guys have to understand is that access to dental care is still so limited. And I'm sure most of you go to the dentist all the time, but there's so many people that don't have access to dental care. And unlike medical insurance, where it pays for everything, right, every time, dental insurance is almost like a discount card. So for most people, they get like $1,000 a year, which is kind of used up in the first visit. So when you're looking at someone that is only making minimum wage, they have a wife, they have a mortgage, they have children, they have all these bills, dentistry kind of goes to the bottom of the line. So this gentleman walked in. He's what we call a bruxer. That means he grinds his teeth. This guy was a truck driver. So while he's driving, he's kind of clenching his teeth. And you can just see like the teeth just got really bad. So our plan was to remove all the teeth, give him some implants, and give him a pretty smile. And again, this is what we do every day in my practice. Next slide. So on the left side is what we call the CT scan. This shows me the width and the height of the bone, right? And on the right side is just a panoramic, just a normal x-ray, just kind of shows me the front view. So the left side is a 3-dimensional x-ray. The right side is a 2-dimensional x-ray. So we use technology in our practice. We use a lot of technology, a lot of innovation, and it is constantly changing, right? So you do take all those education to stay abreast of it. So we use both of this to figure out what we're going to do for the patient. So I took out all his teeth, placed 4 implants on the bottom. Next slide. And I'll show you his picture. I thought there was another picture with his face. This is another patient. Same thing, right? Terminal dentition. And I'm sure you're looking at this and saying, oh my God, wow. I want to give you some statistics. Over 120 million Americans are missing one tooth, and 40 million Americans are missing all their teeth. So it's not, dental implants is becoming more and more important because the baby boomers, which you guys probably don't know, people that were born in the 60s, they're all kind of getting to that age where they're retiring right now. And in the 60s, we didn't have fluoridated water as much as well. So all the dental problems are coming to light. So we're seeing a lot more extractions. Next slide. This is that first patient. Took out all his teeth, and then we gave him a set of dentures with implants in it. His lower denture does not move around, which means he can go out confidently. He can eat an apple, he can crunch on a carrot, and he's as confident as he can be. Next slide. This is that other patient. So that's the second patient. I think I got my slides switched. This was the patient without his denture. I mean, look at his face also. The face on the left is once all the teeth were gone. The face on the right is with the denture. Look at how much younger he looks. So it's very important, like what we do does affect lives, and it affects their self-esteem. I'm sure on the right, he'll probably smile and cheese everywhere. And on the left, he's probably a little bit more self-conscious. So we're gonna go on to the third, and this is probably the most advanced case that I do. It's called a fixed full arch. Some people call it all on 4, some people call it all on 1. we are taking out all the teeth, but instead of snapping the denture in and out, this denture is screwed in. And so it replaces all their teeth, but they don't have to take anything out at night. So you'll never really know that they've lost all their teeth. Next slide. So again, like I said, we utilize a lot of innovation and technology in our practice. This is a younger patient, but you can see all his teeth are discolored. You can see all the teeth are broken and worn down. On the right side, we actually draw his blood, and we do something called PRF, which is platelet-rich fibrin. So we take all the proteins out of his blood. We put the blood in a centrifuge, and we spin the blood, right? And we take all the nice protein in the blood, and we actually use it in his surgery to prevent the swelling, to prevent the pain. And that helps him heal a lot faster. Next slide. So we drew his blood, yes. And those little slugs you see over there, those are the platelet-rich fibrin that we made out of his blood. Took out all the teeth, and that's put into the patient's mouth. It helps the healing, and it helps prevent the swelling so that he can immediately start feeling better. Next slide. So of course, gory, we're placing the implants in. I know these are a little graphic, right? So all the teeth are taken out, and we're placing the implants in, and then next slide. And this is all done in the same day. So we go through the lab process. Sorry. We go through the lab process, and voila, probably about 4 p.m. that evening, that's the patient. Like, it's a whole new smile. So what we do is we use implants to help restore teeth and function. And when we do so, I'm sorry about that. When we do so, we're giving patients back, we're giving them a new lease on life. We're giving them back their smiles and their lives and their families and all the things that they've lost over time. Next slide. So outside of the practice, I'm sure you're wondering, how can you have a life outside of the practice? Yes, I do. Outside of the practice, what do I do? Outside of spending time with my family, like I said, I'm a faculty member at Implant Pathway. Implant Pathway is a comprehensive implant continuum for the general dentist. So like I said, for general dentists, in dentistry, you don't have to go through a specialty program. You can get out and become a general dentist after your 4 years in dental school. But then you have to decide what you want to do. For most people, implants, like I said, is becoming like the future of dentistry. So they want to get a little bit of like education. We do that. We do didactic study, and then we do live implant training. We have a center, it's called the New Horizon Center in Phoenix. The great thing about our center is that it's a charity center. So all the patients that come there to get implants, get them for free, which is free. It's so amazing. I'm sure you guys know implant treatment can cost up to $40,000, and we do it absolutely free for them. So it's always, it's a combination. I get to teach other dentists, but then we also get to give back to the community. So it's a win-win. Outside of that, I'm also a business coach. You're like, oh my God, her life is so full already. Absolutely. I help female medics and dentists avoid burnout. Like I said, burnout is real in medicine. There's only, I feel like there's a group of people that go into medicine and dentistry, right? We're passionate, we want to help people, we want to give. And so we keep giving and giving and giving. And sometimes we don't know when to stop. So we give till we're burned out. So I help women try to figure out the balance, which is so important. If you figure out the balance, you'll find out that you can do so much more, even within a 24-hour day. It's just about balancing things. So I help women redesign their lives by living lives on their own terms, because that's what I do. I go to work, I affect lives, I come home, spend time with my family. I still have time to give back to the community. I do the things that I love, which is teaching other people, and of course, being on this live right now. And then just at the end of the day, feeling very fulfilled. So if you want to learn more, you can find me on social media. My handle is Dr.Jumoke. And thank you all so much for having me.
Thank you so much, Dr. Jumoke, for the presentation. If it's okay, we're going to ask you a few questions that we have.
Sure.
All right. So the first question that we had was, how do you balance your social work life?
So I think the biggest thing is setting boundaries. And a lot of us, unfortunately, don't know how to set boundaries, especially. So, like I said, people that go into medicine, we have a passionate heart. And sometimes people confuse passionate heart and with letting people walk all over them. We need to learn to say no, and we have a hard time doing that. Sometimes I do. People are like, can you do this for me? And you're like, yes. You have to learn, and you have to know your body as well. You can't work 365 days a year, and you can't be everything to everybody. So I think the biggest way that I've been able to do that is set boundaries. For me, also was me figuring out what I love to do. When your work is what you love to do, work stops being work and it's not as stressful. So I love going to work. I've also surrounded myself with the best team. Oh my God, there's so many things. Surrounding yourself with people that have the same vision as you, that understands your passion. So we work really hard at my job. We play really hard as well. And then, of course, when I get home, I make sure I spend time with my family so that my kids are not lacking anything. So it takes a lot of juggling, but I think it's really about boundaries.
Definitely. The next question was, what do you do when you have trouble solving a problem in the job?
Oh, yeah. So I am a big proponent for having mentors. I actually believe in something called a growth circle. I believe that we all are placed in this world and we're supposed to develop that growth circle. And what's in the growth circle? You should have a mentor. There should always be someone in your inner circle that knows more than you. Always. If you're the smartest person in the room, you're in the wrong room. Get out. Okay. You should have a partner or someone that does life with you. Okay. That's called an accountability partner. They push you, they challenge you. I have one like that. He's a dentist and we challenge each other. And three, you should have a mentee. You should always be pouring into somebody else. You should always be pulling somebody up. Those three people help balance you out. So I have a mentor. And if I can't solve a problem, I will call my friend who does life with me, my accountability partner. I will call my mentor. And typically that gets the problem solved.
Awesome. And then, what does it take for your team to work together successfully?
I think it's leadership. Like as a dentist, so one of the things about dentistry is most dentists are going to end up owning their own practice or they're going to be a team leader. So leadership skills always very important. And that's what it takes. You selecting people on your team that are not all the same. That's it. Like my team has different people. They're all not like me because if they were all like me, we would probably just kill each other, right? So you have to select people. I always say select people for their personality and you can teach the skill. That's very important that you have people that can handle just several different things and that makes your team really strong and formidable. But you have to be the leader for sure.
And then, how were you able to work on your dexterity skills?
Ah, dental school will do that to you. um, you know, first year in dental school was rough. Man, it was rough. Like, because they're gonna have you carving these little teeth out of wax. It was rough. You just learn. I believe that practice makes perfect. So the more you do it, the easier it gets. But you're going to log in a lot of hours. I'm sure you've heard that for you to be an expert at something, you need to do it 10,000 times. So you just have to keep doing it and doing it. I really do believe that practice makes perfect.
And then, how did you learn the business aspect of dentistry?
So here's the deal. They don't, well, 20 years ago, going out of dental school, they didn't teach you a lot of that. You got one class on dental management. So just a lot of CE courses and continuing education courses. And life will teach you. That's part of it. But also just kind of making sure that you surround yourself with people that have the same goals. You'll be surprised how much I've learned from other dentists, because I'm around them and saying, hey, this is going on in my office. And then you share ideas. So one of the things that I really do suggest to people, whatever your path is, don't be an island, because you can't do it by yourself and you don't know it all. Always surround yourself with people, because you can always learn from anybody.
Of course. And another question was, do you have any tips for pre-dental students?
That DAT. So yes, the DAT definitely gets you into the school. And, with all these exams, I think definitely doing like a prep course for that DAT was it's been so long, but I remember the prep course really helped me. They do have the dental decks as well. I don't know if they have that now. Do they still have that? The dental decks? They're like these cards. They're like this study cards. So having that as well, and start talking to your advisors. The requirements are changing so much. Again, it was 20 years ago. The requirements are different now. So definitely talk to your course advisor and do it early. Don't wait till the third year before you do it. Like, start from the beginning. If you're really passionate about dentistry, start as soon as you get to school. Find other students that are on the same path as you and exchange notes with them.
Okay, and then what is one piece of advice you wish you told yourself during your dental journey?
Have fun. So I definitely have fun. I was the nerd. So I was always in the books. It's great to be in the books, but just also have some fun. You are in the beginning part of your life and you have so much ahead of you. Don't just do everything in moderation, is what I would say. Yeah.
And then what things in your job give you a sense of accomplishment?
Oh my goodness. When I can restore a smile, for me, because sometimes it happens in a day. They come in one way and they go out the other way. That is really just, oh my God, it really just tugs at my heart when they come in and I'm able to recreate the smile from the picture from 20 years before. They'll come with that picture and say, this was me when I was 20 years old, and now they're 40s and their teeth are in a bad shape. And if I can recreate, and they start crying, and it's always tears of joy. So I've had a lot of those where they cry and they're like, oh my God, I look like myself. That makes everything worth it. Everything.
Yeah, definitely.
Yeah.
And there's also a question about, I know you mentioned that you have a lab in your practice. How long does it actually take to make a set of dentures?
So probably about 4 hours. So it doesn't take, so, we've been able to come up with a proprietary way of making the dentures at affordable dentures and implants. But I do have a full staff in my lab as well. So it does run like a well-oiled machine. So I've got my dental assistants at the front, I've got my office manager, and I've got my lab staff. So I get the impressions to them probably about 9 o'clock, and we can have it by like 2 o'clock the same day.
Okay, cool. And then our final question for you is, what is your favorite procedure?
Definitely implant placement, like, more than extractions. Of course, I started with extractions. I've been doing this for a long time now. Impression taking is not really it, but definitely placing dental implants would be by far my favorite procedure.
Okay, awesome. Thank you so much, Dr. Jumoke, for talking to us today and doing this virtual session. We learned a lot about implant dentistry, as well as owning your own practice and business and lifestyle. So thank you so much.